Good morning. I'm Danielle Root, and this morning I'll be presenting my intervention plan for NSC 802 Population Focused Practice for the Department of Baccalaureate and Graduate Nursing at Eastern Kentucky University. My program hypothesis was that if we educate St. Joseph Mount Sterling clinical nursing staff on palliative care and hospice services and teach the nurses how to identify palliative care and the impact it has on quality of life for patients and families, if we teach them how to describe the characteristics of patients who can benefit from palliative care and hospice services, and also how to locate the resources to address their patients' palliative care needs, utilizing the Centers for Advanced Palliative Care web-based training, an in-depth look at palliative care and its services, then we should see a more comfortable nursing staff who can help increase referral rates for these services. The desired impact is to have an educated clinical nursing staff who can differentiate between hospice and palliative care to help better facilitate the discussion on how these benefits can help their patients who experience chronic and life-limiting illnesses. And thereby, we should see an increase in St. Joseph Mount Sterling referral rates to hospice and palliative care services. The service definition, or the CAPC, which is the Center for Advanced Palliative Care web-based training, an in-depth look at palliative care and its services, enables nurses to identify palliative care and the impact it has on the quality of life for patients and families. So hospice and palliative care the terms hospice and palliative care are often used interchangeably. However, these services are not very different, but these services are different. Palliative care services offer symptom management, but these are for patients that would like to also continue to pursue more aggressive treatments. Therefore, patients who are in palliative care with life-limiting or chronic illnesses such as cancer or COPD can continue to seek outside consultations and still have follow-up visits with their doctors and seek more aggressive treatments such as chemotherapy and things like that, rehab services. Patients who are in hospice, however, do not seek further aggressive treatment. It's understood through the conditions of participation and the CMS guidelines for the hospice Medicare benefit that in order for a patient to go under hospice services, a patient should have a terminal diagnosis, have a prognosis of 6 months or less, and also should not be wishing to seek any further aggressive treatment. Having the conversation about death is a difficult one for nurses and for most healthcare providers. However, it's very important that we have an educated community on what resources are available to them so that we can help facilitate an easier transition into these services. Therefore, having a plan in place to help ensure that we educate all of the nursing staff was determined by myself and Jennifer Smith, who is the clinical nurse educator, to be the best intervention at this time to help reach all of the clinical nursing staff. The actual web-based training is an hour-long web-based training that is free, and it's available on the CAPC website at www.capc.org. And this web-based training is a general orientation. It's just a general overview of what is available through hospice and palliative care services. So our intervention was to incorporate this web-based training into not only clinical orientation for all new hired clinical nursing staff, but also to add it to the annual competencies that's required for all of the nursing staff at St. Joseph Mount Sterling. The St. Joseph Mount Sterling Education Department can better equip these nurses with the knowledge necessary to educate their patients and to confidently place referrals for community resources which can enhance their patients' and families' quality of life. The goal of palliative care is to achieve the best quality of life for patients and their families who are facing problems which are associated with serious or life-threatening illnesses. So having an educated clinical staff on the tenets of hospice and palliative care should help to increase referral rates for the patients in Montgomery County and the surrounding counties. Jennifer Smith, who has an MSN, is the clinical nurse educator at St. Joseph Mount Sterling, and she's a strong advocate for hospice and palliative care. She is a nurse that practiced in the OR as well as the ED, and as I've mentioned, she's the clinical nurse educator. She's dedicated to ensuring that the clinical nursing staff at St. Joseph Mount Sterling are equipped with the best resources to provide the best care for their patients. But she also has a personal experience with hospice and palliative care. And after much discussion, she did give me permission to discuss her situation. She experienced a time where her husband became very ill, and they were constantly looking for treatments and ways to make him feel better, and then ultimately he was diagnosed with cancer. It was after this diagnosis, and it was recognized that there were no further available aggressive treatments, that she found herself in she said the confusion of what was available through palliative care and hospice services. But her husband was experiencing extreme air hunger and shortness of breath, and they were finding themselves in the emergency room far more than they had hoped. So eventually she was teamed up with a palliative care provider, who are the people who are best to help patients and families understand what services are available. He was admitted into hospice, and they were able to provide him with adequate symptom management, and he was able to pass peacefully at home and to avoid any further aggressive treatments. So because of not only her clinical experience, but also her personal experience in the subject matter, she was passionate about the desire to implement this intervention for her hospital. So, in collaboration with St. Joseph Mount Sterling and the education department, we determined that our activities would be to identify an educational resource through the Centers for Advanced Palliative Care, and we did that with the web-based training module. This is free to everyone, and the nurses will also receive one CEU attached to that. We reviewed the CAPC web-based training, and we each took it. And then now the goal is to update the mandatory educational materials to reflect the new edition of the web-based training for new hired nurses, and that we will ensure that the web-based training is added to the mandatory annual competencies for all nurses. So it's not enough to educate them once, but we need to keep this on the forefront of their knowledge base. And then we will present a summary of the web-based training data results to the St. Joseph executive team. Our goal is to have 100% participation. If you are a nurse that practices clinically at St. Joseph Mount Sterling, then you would be required to maintain this annual competency. At the end of the web-based training, there is a certificate of completion that's provided, and that should be printed and turned into the education program, and it will be placed in each nurse's file, each nurse's educational and annual competency file. So the hope is that implementing this educational process, this web-based training for all nursing staff, that we'll see a more educated nursing staff, and that we will actualize more referrals for patients who would qualify and benefit from hospice and palliative care services. Thank you.